Hello, and welcome to another day of Living with Spina Bifida. Today is Mental Health Monday, and I am going to be talking to you about a mental disorder that hits very close to home to me because I was diagnosed with this many years ago, and it affects my daily life tremendously. Seems like it's brought itself to the forefront more and more as the years go by. So it becomes even more part of my daily life. I'm going to be talking to you about borderline personality disorder. Now, what is borderline personality disorder, you may ask? It also could be referred to as BPD for people that like to say things quickly. It is a serious mental illness marked by unstable moods, behavior, and relationships. It wasn't until 1980 that mental health professionals started recognizing borderline personality disorder as a diagnosable illness. Because some people with borderline personality disorder have brief psychotic episodes, experts originally thought of this illness as atypical or borderline versions of other mental illnesses. While mental health experts generally agree that the name borderline personality disorder is misleading, a more accurate term does not exist yet. Most people with borderline personality disorder suffer from problems with regulating thoughts and emotions, impulsive and reckless behavior, and unstable relationships with other people. People with this disorder also have high rates of co-occurring disorders such as depression, anxiety disorders, substance abuse, and eating disorders, along with self-harm, suicidal behaviors, and completed suicides. Research on the possible causes and risk factors for borderline personality disorder is still at a very early stage. However, scientists generally agree that genetic and environmental factors are likely to be involved. Studies on twins with borderline personality disorder suggest that the illness is strongly inherited. Another study shows that a person can inherit his or her temperament and specific personality traits, particularly impulsiveness and aggression. Social or cultural factors may increase the risk for borderline personality disorder. For example, being part of a community or culture in which unstable family relationships are common may increase a person's risk. Impulsiveness, poor judgment in lifestyle choices, and other consequences of borderline personality disorder may lead individuals to risky situations. Adults with borderline personality disorder are considerably more likely to be the victim of violence, including rape and other crimes. To be diagnosed with borderline personality disorder, a person must show an enduring pattern of behavior that includes at least 5 of the following symptoms: extreme reactions, including panic, depression, rage, or frantic actions; 2, abandonment, whether real or perceived; a pattern of intense and stormy relationships with family, friends, and loved ones, often veering from extreme closeness and love or idealization to extreme dislike or anger or devaluation; distorted and unstable self-image or sense of self, which can result in sudden changes in feelings, opinions, values, or plans and goals for the future, such as school or career choices; impulsive and often dangerous behaviors, such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating; reoccurring suicidal behaviors or threats, or self-harming behavior, such as cutting; intense and highly changeable moods, with each episode lasting from a few hours to a few days; chronic feelings of emptiness or boredom; inappropriate, intense anger or problems controlling anger; having stress-related paranoid thoughts or severe dissociative symptoms, such as feeling cut off from oneself, observing oneself from outside of the body, or losing touch with reality. Seemingly mundane events may trigger symptoms. For example, people with borderline personality disorder may feel angry and distressed over minor separations, such as vacations, business trips, or sudden changes of plans from people to whom they feel close. Studies show that people with this disorder may see anger in an emotionally neutral face and have a stronger reaction to words with negative meanings than people who do not have the disorder. Self-injurious behavior includes suicide and suicide attempts, as well as self-harming behavior. According to data, about 1.6% of adults in the United States have borderline personality disorder. It usually begins during adolescence or early adulthood. Unfortunately, borderline personality disorder is often underdiagnosed or misdiagnosed. A mental health professional experienced in diagnosing and treating mental disorders, such as a psychiatrist, psychologist, or clinical social worker, or psychiatric nurse, can detect borderline personality disorder based on a thorough interview and discussion about symptoms. A careful and thorough exam can help rule out other possible causes of symptoms. Women with borderline personality disorder are more likely to have co-occurring disorders such as major depression, anxiety disorders, or eating disorders. In men, borderline personality disorder is more likely to co-occur with disorders such as substance abuse or antisocial personality disorder. No single test can diagnose borderline personality disorder. They're still looking for more ways to improve diagnosis for this disorder. Like I said earlier, it's still a fairly new concept. It's still a fairly new disorder that people are recognizing. It's only a little bit over 30 years old. Borderline personality disorder is often looked at as difficult to treat. However, recent research shows that borderline personality disorder can be treated effectively and that many people improve with this illness over time. Borderline personality disorder can be treated with psychotherapy or talk therapy. In some cases, a mental health professional may also recommend medications to treat specific symptoms. So if you know someone with borderline personality disorder, maybe you do know someone, but you don't know it. Not everyone is as willing and open to talk about their mental illnesses. But for me, it's a part of me, and it takes up a great deal of my life, so I don't want to keep it a secret. Because if you know someone with borderline personality disorder, it affects you too. The first and most important thing to do for a loved one, if you suspect that they do have this disorder, is make sure they are getting the proper help and treatment for the disorder. Encourage them to keep taking their medication if they need to take their medication. Encourage them to keep seeing their therapist or doctor to keep on track and to keep as happy and healthy as possible. Everyone always needs emotional support, understanding, patience, and encouragement. Change of any kind can be difficult and frightening to someone with borderline personality disorder, but it is possible for them to get better over time. Do research on mental disorders of many kinds, including borderline personality disorder, so you can understand what your friend or relative is experiencing. Maybe there's even an option for you to take therapy with them so you can learn more coping skills and get a better understanding of what is going on with your loved one. Never ignore comments about someone's intent or plan to harm themselves or someone else. How can you help yourself if you have borderline personality disorder? Talk to your doctor about treatment plans and stick to the plan. Try to maintain a schedule, a sleep schedule, food schedule, a schedule of your day as best as possible. Engage in mild activity to help reduce stress, set realistic goals for yourself, break up large tasks into small ones, set some priorities, and do what you can as you can. Try to spend time with other people and confide in a trusted friend or family member. Tell others about events or situations that may trigger certain symptoms. Expect your symptoms to improve gradually, not immediately. Identify and seek out comforting situations, places, and people. Continue to educate yourself about this disorder. Like I said in the beginning, this disorder is something that has affected my life tremendously, most likely since childhood. I was only diagnosed with it in my mid-20s. So it hasn't been very long that I have realized what the issue was. And gradually through time, I've been more able to maintain my emotions and my problems. For me personally, the best thing that has helped me with my symptoms is medication. Because once in a while, for whatever reason, I will not have a refill of my medication. And I am just a mess. I am mostly angry. Like every little stressor will set me off in a Hulk-like stage. Like, that's the best way I can describe it. Something will set me off. Most of the time, it is my son. So we butt heads a lot. And I just get out of control. And I say terrible, horrible things. And there's a lot of yelling and screaming and fighting. And he's not in any physical danger. And because I'm admitting now that I'm not a perfect person, no one is in any initial danger when I have what I call an episode. But for me, my biggest trigger is arguing and disagreeing, and I guess things not going my way or the right way, and change. And another smaller one is when we're running out of time and we're being rushed, and that just gets me all in a frenzy. So since becoming a parent, my biggest struggle has been controlling my emotions for him, because no one should have to deal with that. No one should have to deal with such emotions like that, especially a 6-year-old. Because, as much as I hate to say it, I am starting to see a lot of myself at that age in him. He is starting to develop a lot of issues like I had. Knowing what that developed into in myself, I just have to try my darndest to get him the help he needs and keep myself getting the help I need, so possibly he can live an easier life without extreme mental illness. But if that becomes the case, then I guess we know that he has the support that he'll need, because I know what you need to deal with mental illness. I will not ignore it. I will not push it aside. I will not deny there's a problem, because if there's a problem, we need to solve it. And that's the best I can do. It's a daily, hourly, minutely, secondly struggle to control my emotions. But considering how I used to be, I think I've come a long way. In my early 20s, I was self-harming constantly, several times a day. I had several suicide attempts. I would steal. I would lie. I would hurt others around me. I was promiscuous. I was not careful with anything that I did in my life. I was very violent, very angry, and very dangerous at that time to myself and others. And I started to get a hold of things, realize, oh, this is not a normal thing. And I started to get help. And I found a medication that works greatly, not perfectly, but it works amazingly to make things tolerable throughout my days. And I've gone very many years now without any self-harming. I still have suicidal thoughts on a very regular basis, but I don't make any actions. I have not gotten in any public fights with anyone, strangers, people I know, for several years. That was a big issue before, is something didn't go right, and I would just fly off the handle. I would start yelling and screaming and getting in a rage with people at the store, people that worked somewhere, family members. It didn't matter. I didn't care where I was. I was in a blind rage, and I would just yell and scream and rage until I was done. But I haven't done that in several years. I haven't felt the need to. Like I said, medication is helping tremendously. I have found the perfect circle of friends that I need, and I haven't had any drama. I haven't had any fights. I haven't had any issues with people being rude and mean to me in a very long time, because I am finding out who the true important people are in my life. I do have bad days. I do have very down, very depressed days. I do have days where I yell more than I should. I do have days where I can't leave the house because I'm just so anxious about everything. I do have those bad days. They're not going to go away. Like I said, still a daily struggle, but it's still really rather manageable considering where I used to be. Because I am not fighting just for myself. I am fighting for my family. I am fighting for my friends. I am fighting for a life. I don't want to live a life of blind rage and hate and anger and harm. I want to live as normal a life as I can. To do that, I needed to accept that I am different, I have problems, but I can get help for those problems. So I found doctors that could help me with that. I have found medication that can help me with that. I have found the right kind of friends that can help me be the best person that I can be. If you don't have a good support net, then you're destined to fail in anything. You need a support system of some sort, and you need to find that. And I did. And I'm never going to be perfect, but I'm better. Not cured, but I'm better. And if I have a bad day, just try again tomorrow. That's all you can ever do in life, is just keep trying. Don't give up, no matter what it is in your life. Just keep trying. We can all do this. We can get through whatever it is that we need to get through if we just don't give up.